Happy holidays and Merry Christmas to everyone. Today is December 24, 2009. My name is Anna DeLopo and I'm the owner and the main practitioner at Elements in Harmony Acupuncture and Chinese Herbs. I practice in Laguna Hills here in Southern California, and you can read a lot about my work at moveyourqi.com and also at moveyourqi.com. Today I'll be making my 8th video blog, and this is on depression. I know this is not something that you were expecting to hear about the day before Christmas, but believe it or not, there are a lot of people calling me, a lot of new patients coming in specifically for anxiety and depression, and it's not uncommon for it to happen right around Thanksgiving on to the new year. This is not always the happiest time for many people due to grieving. Quite a number of us have members of our family and friends, and some of us pets, who have passed on, and it's hard for many people to let go. Sometimes depression isn't due to any one specific thing. Sometimes it's due to just how we tend to handle things, or it was a culmination. Depression could be due to a culmination of our past, our childhood, things that might have happened throughout our young adult life, and it's hard to heal from. For a country that is heavily medicated for depression, it's still sad to see that so many people are suffering. And in no way in this video blog or through this testimonial do I want to convey that acupuncture and Chinese medicine can replace a really good psychiatrist or psychotherapist, but this can help in conjunction with traditional methods. So I hope that you learned something from this today. I am constantly learning from my patients. I'll read this testimonial and I'll give you my 2 cents. This was written in June 2009, and the patient is anonymous. Depression is not something normally shared, and I rarely discuss my personal battle with family and friends. I agreed to write this, hopefully assisting others who battle serious depression. I suffered from depressive episodes for a large part of my life. The depression cycle would last from a few weeks to as long as 6 months. As a teenager, I thought about the 2 options for my life. The first choice ends the pain of living. The second choice revolved around learning to live with the pain. Each time I thought about the choice, I chose life because I knew that depression would not last forever. As an adult, I learned to recognize the first symptoms of a depressive cycle, working toward not letting the depression overtake my life. In college, my longest episode lasted over 8 months, and at the time I seriously thought about different types of therapy. In the end, I chose not to pursue therapeutic treatment for 2 very simple reasons. The first option, I understood, required taking medications masking the symptoms. I wanted a cure for my depression, not a pill I would take daily to change my mood. The other standard therapy of talking to a therapist never interested me because I never understood how talking about my problems would actually cure my depression. Sure, we all need to vent and to share feelings, but telling some stranger about my personal issues and expecting some magic words of wisdom making the depression end seemed unrealistic. Additionally, all my depressive episodes end after a time, and I knew waiting long enough, this current episode would also end. After college, I experienced various bouts of depression, all eventually ending. In the summer of 2008, I experienced another bout of depression, and knowing about acupuncture, I decided to seek treatments focused on healing, not masking the symptoms. Anna treated me specifically for depression. However, I did not tell the entire history of my depression, just that I battled depression in the past. This probably made treating my depression more difficult for Anna. Anna treated me twice a week for several weeks, each treatment asking how I was improving. The improvement was not overnight. There was no miraculous waking up the next day and feeling totally normal. The process was slow, but steady progress with each treatment. I noticed a very gradual improvement. After several treatments, Anna discussed the option of taking Chinese herbs, assisting the acupuncture treatments. At the end of the treatment, Anna did not insist I take the herbs, instead handed me a package of information about the herbs. I read the information and noted what the herbs did, how the herbs worked, and decided to take the herbs in addition to the acupuncture. The main point of the herbs was not to mask the symptoms, but assist in healing my body from the causes of depression. During the next treatment, I agreed taking the herbs on top of the acupuncture, and in about 2 months, the depression ended. While this might seem like a long time to some, what I know about my battle with depression and the seriousness of the battle, 2 months was comparably short. I have not experienced any depressive symptoms in the past 10 months. Acupuncture healed the underlying causes of my depression and not only masked my symptoms. I highly recommend Anna as an acupuncturist and acupuncture as a therapy option for depression. Again, this testimonial, pretty long, so thank you so much for listening, was written in June 2009. It is now December 2009, and this patient has not had any complaints of depression. Hopefully, come December 2010, I'll still be publishing that this particular person, who remains anonymous, is still no longer dealing with depression. I'd like to make it clear that my specialty in my practice for over the past 10 years has not revolved around any type of emotional disorders. There is not one set way to treat anxiety, depression, or any type of emotional disorders. Everyone has to be treated separately as an individual for their particular complaints. Since 2006, I've been focusing on the treatment of pain. I help people graduate from pain. That is my specialty. And my strategy for that is that people give me 6 to 10 treatments, and hopefully by then they'll see 20 to 100% improvement. If they don't see at least a 20 or 30% improvement, then I request that they give me another 5 to 10 treatments. If by treatment number 20, for the treatment of pain, they don't feel a total of at least 30 to 80% improvement, I no longer treat them. I feel that another type of therapy is much better because pain is something that I'm extremely good at treating. With depression, anxiety, stress, any type of bipolar, any type of psychiatric disorder, it's always important, in my opinion, that they are seeking a professional therapy, and if they're going to be doing Chinese medicine in conjunction to their professional therapy, that they really consider giving this a few years, because psychiatric disorders are not easy to treat. There's no give me 10 to 20 treatments, let's see how you feel, because a person can already be having a good cycle, and then they might cycle into a really bad state of depression. There's not always any rhyme or reason, and typically the people who's come to see me are patients who are like this person, or people who've been on Effexor or Prozac or some kind of psychiatric medication, and they want to try to get off it. So what I recommend at that point is that they seriously talk with their medical doctor who has prescribed the medication, and let them know that they're working with an acupuncturist, and hopefully we can work in conjunction with their physician, and the physician can guide them as they slowly get off their medication. It's not easy. Treating depression is not easy. But I wanted to address it today because I'm getting countless phone calls right now, and I'm sad for all of these patients, and I hope that this testimonial from this person gives many of you hope, if not joy, for many that thought that there was no light at the end of the tunnel. So thank you. God bless all of you, and I hope that you really find a reason to smile and have fun with people. Hopefully your family and your closest friends during this holiday season. Take care and Merry Christmas.